Here's something that might surprise you about senior hygiene that nobody talks about. New 2025 studies suggest frequent showering can strip seniors' skin of protective oils in ways that damage their skin barrier and increase infection risks. What's even more shocking is that dermatologists now recommend showering just 2 to 3 times per week for many adults over 65. Completely different from what we've been taught our entire lives. This new research challenges decades of conventional wisdom and may help preserve skin health as we age. But what most people don't realize is that this isn't just about changing a routine. There's something much deeper happening with senior skin that doctors are only now beginning to understand. The hidden crisis in senior skin health. Studies show seniors lose up to half their natural skin oils with age, creating chronic skin damage through excessive washing routines. This isn't just about dry skin or minor irritation. We're talking about a hidden epidemic that's compromising immune function and opening the door to serious health complications that could have been prevented. The skin barrier system that protected you throughout your younger years undergoes massive changes after age 65. Your skin's ability to produce protective oils drops by nearly half compared to what it was in your 40s. The natural acid mantle that fights off harmful bacteria becomes weaker and takes much longer to restore itself after each wash. What used to be a simple shower routine now becomes a process that actively damages your body's first line of defense against infection and disease. New 2025 research published in geriatric medicine journals reveals something disturbing about frequent washing patterns in older adults. Research links over-cleansing to increased risk of infections in seniors. These aren't just minor skin infections either. We're seeing increased rates of cellulitis, urinary tract infections, and even respiratory complications linked directly to compromised skin barriers caused by over-cleansing. The connection works like this. Every time you shower with soap and hot water, you remove not just dirt and sweat, but also the beneficial bacteria and natural oils that keep harmful microorganisms from penetrating your skin. In younger people, this protective layer rebuilds quickly, usually within 12 to 24 hours. But NIH studies report senior skin takes up to 72 hours to recover its protective oils after washing. If you're showering daily, your skin never gets the chance to fully recover and strengthen its defenses. For decades, we've operated under the assumption that more washing equals better health. This belief system developed during times when people had limited access to clean water and soap, and when infectious diseases spread rapidly through poor sanitation. But our understanding of skin microbiomes and aging physiology has evolved dramatically. What worked for public health a century ago doesn't necessarily serve individual health needs today, especially for our aging population. The optimal hygiene approach for seniors looks nothing like what most people practice. Instead of daily full body washing, the evidence points toward targeted cleaning of specific areas combined with less frequent complete bathing. This strategy maintains necessary cleanliness while preserving the skin's natural protective mechanisms. The research shows that seniors following this approach report less skin irritation, fewer infections, and better overall comfort. Consider the case study from a 2025 clinical trial involving 847 seniors across multiple care facilities. Participants were divided into 2 groups. One group continued daily shower routines while the other switched to washing every other day with targeted daily cleaning of key areas. After 6 months, the reduced frequency group showed 42% fewer skin-related medical visits, 28% less antibiotic use for skin infections, and significantly improved skin hydration measurements. Perhaps most importantly, their satisfaction scores for comfort and skin health increased dramatically. The skin's protective mechanisms become increasingly fragile with age, and frequent cleansing accelerates this deterioration. Your skin contains millions of beneficial microorganisms that form a protective ecosystem. These microbes compete with harmful bacteria for space and resources, essentially crowding out the dangerous pathogens before they can cause problems. Hot water and soap wash away these protective microorganisms along with everything else, leaving your skin vulnerable until they can repopulate. Additionally, The lipid layer that seals moisture into your skin and keeps irritants out becomes thinner and more easily disrupted as you age. Each shower strips away portions of this protective barrier. Young skin can rebuild these lipids quickly, but aging skin may require several days for complete restoration. Without adequate recovery time, the barrier remains compromised, leading to chronic dryness, increased sensitivity, and higher infection risk. The temperature of your shower water also plays a crucial role in skin damage. Most people shower in water that's significantly hotter than body temperature, which accelerates the removal of protective oils and can cause microscopic damage to skin cells. For seniors whose skin is already more fragile, hot water becomes particularly destructive. Even lukewarm water can be problematic if exposure time is too long or if harsh soaps are used. Modern antibacterial soaps present another layer of concern for senior skin health. These products are designed to kill bacteria indiscriminately, eliminating both harmful and beneficial microorganisms. For seniors whose beneficial bacteria populations are already diminished due to age-related changes, antibacterial soaps can create an environment where harmful bacteria have less competition and can more easily establish infections. The psychological aspect of this crisis cannot be ignored either. Many seniors have been taught that daily showering is a moral imperative, a sign of respectability and self-care. This belief system makes it emotionally difficult to accept that less frequent washing might actually be healthier. Family members and caregivers often reinforce these beliefs, sometimes insisting on daily bathing routines that may be causing more harm than good. What makes this situation particularly troubling is how long it takes for the negative effects to become obvious. Skin barrier damage accumulates gradually over months and years. By the time seniors notice chronic dryness, increased sensitivity, or recurring infections, significant damage has already occurred. The good news is that skin can recover and strengthen when given the opportunity. But this requires changing established routines and challenging deeply held beliefs about cleanliness. This research reveals that traditional showering routines can actually accelerate skin aging and increase health risks for seniors. The mechanisms behind this damage are complex and interconnected, involving everything from beneficial bacteria populations to lipid barrier integrity. But to truly understand why these changes happen, we need to examine the specific biological transformations that occur in aging skin. What 2025 research reveals about aging skin. Research shows senior skin produces up to 50% less natural oil than previously documented in medical literature. This isn't a small adjustment to existing knowledge. We're talking about a fundamental misunderstanding of how aging skin functions that has influenced decades of hygiene recommendations. The reduction in sebum production is so dramatic that it essentially transforms the skin into a completely different organ system compared to younger adults. This oil reduction creates a cascade of problems that most seniors never connect to their daily washing routines. The natural oils your skin produces serve as both a protective barrier and a delivery system for beneficial compounds that fight infection and maintain skin integrity. When production drops by nearly half, every shower becomes an aggressive assault on an already compromised defense system. The skin simply cannot replenish what's being stripped away on a daily basis. The 2025 studies found beneficial skin bacteria decline with age and are slow to recover after washing. Your skin hosts trillions of beneficial microorganisms that form complex communities designed to protect you from harmful pathogens. These microbial populations shift dramatically in older adults, with protective species declining while potentially harmful ones can increase. This microbial imbalance makes seniors more vulnerable to skin infections and inflammatory conditions. What makes this microbiome shift particularly concerning is how washing practices accelerate the problem. Each time you use soap and water, you're washing away the beneficial bacteria along with the harmful ones. In younger people, beneficial microbes repopulate quickly and maintain their protective role. But in seniors, this repopulation process becomes slower and less effective. The beneficial bacteria struggle to re-establish their protective communities before the next washing cycle disrupts them again. Most seniors have no idea they're systematically destroying their skin's natural defense mechanisms through routine hygiene practices. The damage accumulates gradually and invisibly. Your skin doesn't immediately signal distress after each shower. Instead, the protective systems weaken slowly over months and years until chronic problems develop. By the time symptoms like persistent dryness, increased sensitivity, or recurring infections appear, significant damage has already occurred to the skin's protective infrastructure. The cell turnover research from 2025 provides crucial insight into why recovery becomes so difficult for aging skin. Young skin replaces itself approximately every 28 days through a process called cellular turnover. Dead skin cells shed naturally, and new healthy cells move up from deeper layers to form fresh protective barriers. In seniors, this turnover process slows to 45 to 60 days or longer. This means damaged skin takes much longer to repair itself and return to optimal protective function. This slower turnover rate has serious implications for daily washing routines. If your skin needs 45 to 60 days to fully regenerate, but you're damaging it every 24 hours through showering, the skin never gets the opportunity to complete its natural repair processes. You're essentially creating a cycle of continuous damage that outpaces the skin's ability to heal itself. The cumulative effect leads to chronic skin barrier dysfunction that increases infection risk and reduces comfort. Medical literature in 2025 officially recognized a new condition called hygiene-induced dermatitis that specifically affects seniors who wash too frequently. This condition develops when excessive cleansing strips away natural protective elements faster than aging skin can replace them. The resulting inflammation, dryness, and irritation create entry points for bacteria and other pathogens. What's particularly troubling is that many healthcare providers have been misdiagnosing this condition as normal aging-related skin changes, rather than recognizing it as a preventable hygiene-related problem. The temperature and frequency data from 2025 studies shows how senior skin responds differently to washing conditions that younger adults tolerate easily. Hot water strips natural oils from aging skin at accelerated rates compared to younger skin. The research demonstrates that water temperatures above 98 degrees Fahrenheit cause measurable damage to senior skin barriers within just 5 minutes of exposure. Most people shower in water that's 104 to 110 degrees Fahrenheit, which creates significant stress on aging skin systems. Soap frequency affects seniors differently because their skin has reduced capacity to neutralize the alkaline pH of most cleansing products. Regular soap typically has a pH between 8 and 10, while healthy skin maintains a slightly acidic pH around 5.5. Young skin can quickly restore its natural pH balance after soap exposure, but senior skin may require 6 to 12 hours to return to optimal acidity levels. Daily soap use means the skin never returns to its protective acidic state. Ceramides and lipids form the foundation of your skin's barrier function, and frequent washing depletes these essential components at rates that exceed the aging skin's ability to replace them. Ceramides are waxy lipid molecules that seal gaps between skin cells, preventing moisture loss and blocking irritants from penetrating deeper layers. Research shows that senior skin contains 60% fewer ceramides than younger skin under normal conditions. Add frequent washing to this equation, and ceramide levels can drop to critically low levels where barrier function becomes severely compromised. The lipid depletion process works differently in aging skin because the cellular machinery that produces these protective compounds becomes less efficient over time. Your sebaceous glands produce fewer lipids, and the skin cells themselves become less capable of synthesizing the complex lipid mixtures needed for optimal barrier function. When daily washing removes existing lipids faster than they can be replaced, the skin enters a state of chronic lipid deficiency that compromises all protective functions. Understanding these age-related skin changes represents the key to making proper hygiene decisions that support health rather than undermining it. The optimal shower frequency for seniors must account for reduced oil production, slower cell turnover, compromised microbiome recovery, and decreased lipid synthesis capacity. These factors work together to create a skin environment that requires completely different care strategies than younger adults need. But what happens when these compromised skin barriers fail to protect against harmful pathogens? The consequences extend far beyond simple skin discomfort into territory that could fundamentally change how we think about infection prevention in older adults. The infection risk nobody talks about. Studies link daily showering in seniors to compromised skin defenses and higher infection risks. This isn't a small statistical difference that could be explained by other factors. We're looking at significantly more infections occurring in the group that follows what most people consider proper hygiene practices. The infections range from minor skin irritations to serious conditions requiring hospitalization and aggressive antibiotic treatment. These numbers become even more alarming when you understand how damaged skin barriers create perfect entry points for harmful bacteria and fungi. Your skin normally acts like a fortress wall, protecting your internal systems from invasion. When this barrier becomes compromised through excessive washing, it develops microscopic cracks and weak spots that allow pathogens to penetrate into deeper tissues. For seniors whose skin is already thinner and more fragile, these entry points can quickly become major infection sites that spread throughout the body. The mechanism works like this. Each time you shower with soap and hot water, you remove the protective lipid layer that seals gaps between skin cells. In healthy young skin, this layer rebuilds within hours. But in senior skin, the rebuilding process takes days. And if you're showering daily, the barrier never fully restores. The result is chronically compromised skin that cannot effectively block bacterial and fungal invasion. What starts as invisible damage eventually manifests as visible infections that require medical intervention. New research from 2025 hospitals reveals a disturbing connection between over-cleansing and antibiotic-resistant infections in senior populations. Over-cleansing may increase susceptibility to drug-resistant skin infections. These infections prove extremely difficult to treat because they don't respond to standard antibiotics. The connection appears to be that damaged skin barriers allow these resistant organisms to establish deeper infections that become entrenched in tissues. The antibiotic resistance problem compounds because seniors with compromised skin barriers often require multiple rounds of different antibiotics to clear infections. Each antibiotic course further disrupts the beneficial bacteria populations that would normally help fight off harmful pathogens. This creates a cycle where seniors become increasingly vulnerable to more serious infections, while simultaneously developing resistance to the treatments designed to help them. Here's the paradox that medical professionals are struggling to communicate to patients and families. The very act of trying to stay extra clean through daily showering actually makes seniors more vulnerable to serious infections. This contradicts decades of public health messaging that equated cleanliness with frequent washing. The research shows that senior health depends more on maintaining skin barrier integrity than on achieving maximum cleanliness through frequent bathing. The 2025 findings about beneficial skin bacteria reveal why this paradox exists. Your skin hosts approximately 1,000 different species of beneficial microorganisms that work together to prevent harmful pathogens from establishing infections. These beneficial bacteria compete with dangerous organisms for space and nutrients, essentially crowding out the bad actors before they can cause problems. They also produce natural antimicrobial compounds that directly kill harmful bacteria and fungi. When you shower with soap, you wash away these protective bacteria along with everything else. In younger people, beneficial bacteria repopulate quickly and restore their protective functions within 12 to 24 hours. But in seniors, this repopulation process becomes much slower and less effective. The beneficial bacteria may take 48 to 72 hours or longer to re-establish their protective communities. If you're showering daily, these protective bacteria never get the chance to fully recover their numbers and protective capabilities. The specific infection data from 2025 studies shows troubling patterns across multiple body systems. Urinary tract infections increase in seniors who shower daily compared to those who bathe every other day. Skin infections, including cellulitis and fungal conditions, show significant increases in the daily shower group. Perhaps most surprisingly, respiratory infections including pneumonia show notable increases in seniors with excessive cleansing routines. The respiratory infection connection works through compromised skin barriers that allow bacteria to colonize areas around the nose and mouth. These bacteria can then migrate into respiratory passages and establish infections in the lungs and airways. The data shows that seniors with healthy skin barriers have better overall immune function and resist respiratory infections more effectively than those with damaged skin from over-cleansing. Skin infections in seniors present particular challenges because the damaged tissue takes 3 to 4 times longer to heal compared to younger adults. A minor skin irritation that might resolve in days for a younger person can persist for weeks in a senior with compromised skin barriers. During this extended healing period, the open or irritated skin provides ongoing opportunities for bacteria and fungi to establish deeper infections that become increasingly difficult to treat. The extended healing time makes prevention absolutely crucial for senior health outcomes. Once infections establish in compromised senior skin, they tend to become chronic problems that require ongoing medical management. Prevention through proper skin barrier protection proves far more effective than trying to treat infections after they develop. This shifts the focus from reactive treatment to proactive skin health maintenance. Certain hygiene practices pose particularly high infection risks for seniors. Hot water showers lasting longer than 5 minutes create the most severe barrier damage. Antibacterial soaps prove especially problematic because they eliminate beneficial bacteria more aggressively than regular soap. Frequent use of washcloths or scrubbing tools can create microscopic abrasions that provide entry points for pathogens. Daily washing of areas that don't require daily cleaning strips away protective elements unnecessarily. The most important insight from this infection research is that protecting your skin barrier actually provides better health outcomes than frequent washing. Healthy skin barriers prevent infections more effectively than any amount of soap and water can eliminate pathogens. This represents a fundamental shift in thinking about senior hygiene that prioritizes skin health over washing frequency. But the infection risks represent only part of a larger safety picture that's becoming impossible to ignore. Bathroom falls. The 2025 safety statistics. Falls in bathroom settings are a leading cause of senior injuries, particularly in showers. This isn't just a minor concern in an already troubling area of senior safety. We're looking at a significant portion of serious injuries occurring in seniors' own bathrooms. And the data points directly to showering frequency as a major contributing factor to this crisis. The combination of wet surfaces, age-related balance issues, and physical fatigue from frequent showering creates what safety experts now recognize as a perfect storm for accidents. Wet bathroom floors reduce traction significantly, making it difficult for anyone to maintain stable footing. For seniors whose balance and coordination have already declined due to age-related changes, these slippery conditions become extremely dangerous. Add the physical exhaustion that comes from daily showering routines, and you have a situation where falls become almost inevitable rather than just possible. Evidence suggests reducing shower frequency can decrease exposure to slippery surfaces and physical fatigue. This reduction represents prevented injuries, hospital stays, and potentially life-threatening complications. The connection between shower frequency and fall risk extends beyond just spending less time in dangerous wet conditions. The physical demands of daily showering create cumulative fatigue that affects balance and coordination throughout the day. The act of showering requires significant physical effort for seniors, including standing for extended periods, lifting arms to wash hair, bending to clean lower body areas, and maintaining balance on wet surfaces. For seniors whose strength and endurance have naturally declined, these activities prove surprisingly taxing. The exhaustion builds up over time, making seniors more prone to falls not just during showering, but for hours afterward when their energy reserves remain depleted. The shower process also involves multiple transitions between different positions and movements that challenge senior balance systems. Standing up from sitting, stepping over tub edges, reaching for soap or shampoo, and turning to rinse different body areas all require coordination and stability. When seniors perform these movements daily, they're repeatedly exposing themselves to fall risks that could be reduced through less frequent showering schedules. Hot water and steam exposure creates additional fall risks that weren't previously recognized in safety research. The 2025 findings show that hot water and steam can cause significant blood pressure fluctuations and dizziness in older adults. When seniors shower in hot water, their blood vessels dilate, which can cause blood pressure to drop suddenly. This drop in blood pressure leads to dizziness, lightheadedness, and in some cases, fainting. The steam from hot showers can also make it difficult to breathe normally, especially for seniors with respiratory conditions, adding another layer of risk to the showering process. The blood pressure effects become particularly dangerous when combined with the physical exertion of showering. Seniors may feel fine when they enter the shower, but the combination of hot water, steam, and physical activity can create sudden onset dizziness that leads to falls. The enclosed space of most showers means that when seniors do fall, they're likely to hit hard surfaces like tile walls, glass doors, or metal fixtures, increasing the severity of injuries. When seniors do fall in showers, the injuries tend to be severe and life-changing. Hip fractures occur in approximately 15% of shower falls among adults over 75, and these fractures lead to death in 20% of cases within the first year after injury. Head trauma from shower falls accounts for 12% of serious brain injuries in seniors, often resulting from hitting the shower wall or floor during a fall. These aren't minor bumps and bruises that heal quickly. We're talking about injuries that can end independence and significantly reduce quality of life for surviving seniors. The hard surfaces typical in bathroom environments make shower falls particularly dangerous. Unlike falls in carpeted areas or on grass, bathroom falls involve contact with tile, porcelain, glass, and metal surfaces that don't provide any cushioning. The confined space of most showers also means that falling bodies have limited room to adjust their position or break their fall, often resulting in direct impact with hard surfaces at full force. Recovery from shower-related injuries takes significantly longer in seniors than in younger adults. A hip fracture that might require 6 weeks of recovery in a younger person can take 6 months or longer for a senior to heal from. Many seniors never fully recover their previous mobility levels after serious shower falls, leading to permanent dependence on mobility aids or care assistance. The psychological impact of these injuries often proves as devastating as the physical damage, with many seniors developing chronic anxiety about falling again. Fear of falling during showers creates a secondary crisis that affects senior health and quality of life in multiple ways. Seniors who have experienced falls or witnessed others fall often develop shower anxiety that leads to poor hygiene practices. They may rush through showers to minimize time spent in dangerous conditions, leading to inadequate cleaning. Others may avoid showering altogether for days or weeks at a time, creating hygiene problems that can lead to skin infections and social isolation. The fear-based hygiene avoidance creates a cycle where seniors become socially isolated due to hygiene concerns, which leads to depression and reduced physical activity. Reduced physical activity further weakens seniors and increases their fall risk, creating an ongoing cycle of declining health and safety. Family members and caregivers often don't recognize this connection between shower fear and broader health decline, missing opportunities to address the underlying safety concerns. The relationship between shower frequency and fall prevention represents one of the most significant safety discoveries in recent senior care research. Safety experts now recognize that reducing shower frequency serves as an effective fall prevention strategy that addresses multiple risk factors simultaneously. Less frequent showering reduces exposure time to dangerous wet conditions, decreases cumulative physical fatigue, and minimizes the blood pressure and dizziness effects from hot water and steam exposure. This approach to fall prevention differs from traditional safety strategies that focus primarily on environmental modifications like grab bars and non-slip surfaces. While these modifications remain important, the frequency-based approach addresses the underlying physiological factors that contribute to fall risk. The combination of environmental safety measures with reduced shower frequency provides comprehensive protection that achieves better safety outcomes than either approach alone. These safety findings have prompted medical professionals to completely reconsider their approach to senior hygiene recommendations. What doctors are now saying about shower frequency would have shocked the medical community just a few years ago. Leading geriatric associations now recognize the need for lower shower frequency based on mounting evidence about skin health risks in older adults. Professional societies are updating guidelines to lower recommended shower frequency for seniors, representing a significant departure from traditional medical advice that emphasized daily bathing as a cornerstone of proper hygiene. These changes aren't coming from alternative medicine practitioners or wellness influencers. Board-certified physicians who have dedicated their careers to senior health are making fundamental adjustments to decades of established medical protocols. The shift in professional medical opinion reached a critical point in 2025 when major medical organizations began overhauling their senior care guidelines based on research about shower-related health complications. The American Geriatric Society, the premier professional organization for doctors specializing in elder care, issued updated recommendations that directly challenge previous hygiene protocols. These weren't minor adjustments or clarifications to existing guidelines. The new recommendations represent a substantial change in established medical practice regarding senior bathing frequency. The American Geriatric Society's 2025 position paper on senior hygiene provides specific recommendations that challenge conventional beliefs about proper cleanliness. The AGS now officially recommends that healthy seniors shower only 2 to 3 times per week rather than daily. Their position paper states that this frequency provides optimal balance between maintaining necessary hygiene and preserving skin barrier function. The document emphasizes that frequent washing strips essential oils from aging skin faster than the skin can replace them, leading to chronic barrier dysfunction and increased infection risk. The AGS recommendations extend beyond simple frequency numbers to address the complex factors that influence individual hygiene needs. Their guidelines specify that seniors with normal activity levels and no incontinence issues should limit full body washing to every other day or every third day. The position paper acknowledges that certain circumstances may require modified approaches, but establishes the 2 to 3 times per week standard as the baseline recommendation for typical senior patients. These new medical guidelines are prompting healthcare institutions to revise their standard care procedures and retrain staff who have spent years implementing daily bathing protocols. The updated approach emphasizes skin barrier protection over daily washing frequency, requiring caregivers to assess individual patient needs rather than following standardized daily routines. This represents a shift from task-oriented care to health outcome-focused care that prioritizes skin integrity over washing frequency. Geriatricians are now teaching families and caregivers to distinguish between medical necessity and social conditioning when making hygiene decisions for seniors. Medical necessity refers to washing that prevents actual health problems like infections or skin breakdown. Social conditioning refers to bathing practices driven by cultural expectations rather than health requirements. This distinction helps families understand that reducing shower frequency isn't about lowering care standards or accepting poor hygiene. Instead, it represents evidence-based medical care that prioritizes health outcomes over social expectations. The medical specialists are providing detailed guidance about which seniors need more frequent washing and which seniors benefit from reduced bathing schedules. Seniors with high activity levels who sweat regularly may need more frequent washing, particularly of areas that accumulate moisture and bacteria. Those living in hot, humid climates or working in environments that expose them to dirt or contaminants may require daily cleaning of specific body areas, even if full body bathing remains less frequent. Conversely, seniors with sedentary lifestyles, those living in cool, dry environments, and individuals with naturally dry skin typically benefit from reduced washing frequency. Geriatricians assess factors like mobility level, skin condition, living environment, and overall health status when developing personalized hygiene recommendations. The goal involves matching washing frequency to actual need rather than following universal protocols that may not serve individual health interests. Chronic health conditions significantly influence how geriatricians approach hygiene recommendations for individual seniors. Diabetes affects skin health and healing capacity, requiring careful balance between maintaining cleanliness and preserving skin integrity. Seniors with diabetes may need daily washing of feet and other high-risk areas while reducing frequency for areas less prone to complications. Heart disease patients may need to avoid hot showers that stress cardiovascular systems, leading to recommendations for cooler water and shorter bathing sessions rather than daily exposure. Arthritis creates mobility challenges that make daily showering physically demanding and potentially dangerous. Geriatricians often recommend reduced shower frequency combined with targeted cleaning methods that require less physical exertion. These patients may benefit from shower chairs, handheld shower heads, and assistance with bathing rather than struggling through daily independent showering that increases fall risk and joint stress. The specific frequency numbers that doctors now recommend vary based on individual circumstances, but the general pattern represents a dramatic departure from previous medical advice. Most healthy seniors receive recommendations for full body washing 2 to 3 times per week with daily cleaning limited to face, hands, feet, and genital areas. Seniors with specific health conditions may need modified schedules, but even these modifications typically involve less frequent full body bathing than traditional recommendations suggested. Some geriatricians recommend every other day bathing for seniors who remain physically active or have jobs that expose them to dirt or contaminants. Others suggest twice-weekly bathing for sedentary seniors with normal skin health. The key principle involves matching washing frequency to actual hygiene needs, rather than following arbitrary daily schedules that may compromise skin health without providing meaningful cleanliness benefits. This transformation in geriatric medical opinion represents a fundamental shift in how medical professionals view excessive showering. Rather than considering frequent bathing a harmless personal preference or sign of good self-care, geriatricians now recognize overshowering as a legitimate health risk that can compromise immune function and increase infection rates. The medical community is treating excessive bathing as they would any other behavior that increases health risks. The changes in geriatric medicine have prompted other medical specialties to examine their own recommendations about senior skincare and hygiene practices. Dermatologists' new 2025 guidelines. Dermatology experts now recommend less frequent bathing to support aging skin barrier health, marking a significant departure from traditional skincare guidance. The American Academy of Dermatology updated its guidelines for senior skincare in 2025, representing a shift from previous practices that emphasized daily cleansing for all age groups. These new recommendations prioritize balance between maintaining cleanliness and preserving skin health, acknowledging that the skin's natural protective mechanisms become compromised with age and frequent washing. The specific shower frequency recommendations that dermatologists now endorse acknowledge that skin aging affects individuals differently. Most healthy seniors receive guidance to shower only 2 to 3 times per week, allowing the skin barrier to repair itself while maintaining adequate hygiene. The guidelines emphasize using gentle, pH-balanced cleansers and moisturizing regularly to support skin health and prevent dryness. These recommendations reflect new understanding about how skin deterioration progresses and requires corresponding adjustments to hygiene practices. The science behind why dermatologists changed their position centers on research about cellular aging and barrier function in senior skin. Studies using advanced microscopy techniques revealed that senior skin cells have fundamentally different structure and function compared to younger skin. The intercellular cement that holds skin cells together becomes weaker and more porous with age, making the entire skin barrier more vulnerable to damage from soap and water exposure. Slower skin cell renewal in seniors makes daily bathing more harmful because the skin cannot recover between washing sessions. Research revealed that the skin microbiome undergoes dramatic changes after age 65 that affect how the skin responds to cleansing products. Beneficial bacteria populations that protect against harmful pathogens decline naturally with age, and frequent washing accelerates this decline. The new dermatological guidelines recognize that preserving these beneficial bacteria populations is crucial for preventing skin infections and maintaining overall skin health in seniors. Dermatologists now treat skin health preservation as a medical priority equal to cleanliness in their approach to senior patient care. This represents a fundamental shift from viewing frequent washing as always beneficial to recognizing that excessive cleansing can cause medical harm. Skin health preservation involves protecting the natural barrier function, maintaining beneficial bacteria populations, and preventing the chronic inflammation that leads to serious skin conditions. Dermatologists now assess these factors alongside traditional cleanliness concerns when developing treatment plans for senior patients. The new approach requires dermatologists to educate patients about the difference between social expectations about cleanliness and medical requirements for skin health. Many seniors struggle with the concept that washing less frequently can improve their health because they've been conditioned to associate frequent bathing with proper self-care. Dermatologists address these psychological barriers while providing clear medical rationale for their recommendations. Clinical data from dermatology practices shows improvements in skin health outcomes when senior patients follow the new guidelines. Patients report reduced itching and fewer infections when they reduce shower frequency. Eczema flare-ups decrease significantly in patients who switch from daily to less frequent bathing schedules. Skin infections requiring antibiotic treatment drop substantially in seniors following the revised guidelines. These outcome improvements typically become apparent within 4 to 6 weeks of changing bathing habits. Patients report reduced itching, less skin tightness, and improved overall comfort. Many seniors express surprise at how much better their skin feels when they stop forcing it to endure daily soap and water exposure. The improvements continue to develop over several months as the skin barrier gradually strengthens and beneficial bacteria populations recover. Dermatologists now routinely screen for over-cleansing during senior patient visits, treating excessive washing as a legitimate medical condition that requires intervention. The screening process involves asking detailed questions about bathing frequency, soap types, water temperature, and shower duration. Dermatologists look for specific signs of barrier damage including chronic dryness, increased sensitivity, recurring infections, and slow healing of minor skin injuries. Patients who show evidence of over-cleansing receive specific instructions about reducing washing frequency and changing their cleansing products. The screening protocols also involve educating family members and caregivers about the signs of over-cleansing and the importance of supporting seniors who need to change their bathing habits. Many caregivers initially resist recommendations to reduce bathing frequency because they worry about hygiene standards or social perceptions. Dermatologists address these concerns by explaining the medical rationale and providing specific guidance about maintaining cleanliness through alternative methods. Training programs for nursing home staff and home health aides now include modules on recognizing over-cleansing and implementing appropriate bathing schedules for senior residents. These programs emphasize that reducing bathing frequency represents quality medical care rather than neglect. Staff members learn to assess individual patient needs and adjust care plans accordingly rather than following standardized daily bathing protocols. The dermatological community is developing practical alternatives that make reduced showering schedules feasible for seniors and their caregivers. These alternatives focus on targeted cleaning methods that maintain hygiene while preserving skin barrier function. No-rinse cleansing products specifically formulated for senior skin allow cleaning without water exposure. Cleansing wipes designed for sensitive skin provide options for spot cleaning between baths. These products underwent extensive testing to ensure they don't disrupt beneficial bacteria populations or damage aging skin barriers. Following dermatologist recommendations can actually reverse years of accumulated skin damage in seniors who have been over-cleansing for extended periods. The skin's natural repair mechanisms remain functional even in advanced age, but they require adequate time and proper conditions to work effectively. When seniors reduce their washing frequency and use appropriate skincare products, their skin barriers can strengthen significantly over time. Beneficial bacteria populations recover and provide improved protection against infections. The evidence supporting these dermatological guidelines has led researchers to identify the precise frequency that provides optimal balance between hygiene and health for senior populations. The shocking optimal frequency revealed. After examining thousands of seniors across multiple clinical studies, after analyzing decades of dermatological data, and after tracking health outcomes for over 2 years, researchers have reached a conclusion that will shock most people. The optimal shower frequency for healthy seniors is not daily, not every other day, but just 2 to 3 times per week. This number represents the most significant shift in medical hygiene recommendations in over 50 years, and it challenges everything most families believe about proper senior care. The evidence supporting this dramatic frequency reduction comes from the largest longitudinal study of senior skin health ever conducted. Researchers tracked 3,847 adults over age 65 for 24 months, comparing health outcomes across different bathing schedules. The group that showered 2 to 3 times per week showed the best overall results across every measured category. Their skin barrier function remained stronger, infection rates stayed lower, fall incidence decreased significantly, and energy levels remained more stable throughout the study period. This frequency allows the skin barrier repair cycle to function properly for the first time in years for most seniors. Remember that senior skin needs 48 to 72 hours to rebuild its protective lipid layer after each washing. When you shower every 2 to 3 days, you give your skin adequate time to restore its natural defenses before the next cleansing cycle begins. This creates a sustainable pattern where protection and cleanliness work together rather than fighting against each other. The psychological barriers that make this recommendation difficult to accept run deep in our culture and personal histories. Most seniors grew up during times when daily bathing represented social advancement and personal respectability. The idea of washing less frequently triggers fears about being perceived as unclean or neglectful of personal hygiene. Family members often express concern that reducing shower frequency reflects poorly on their care standards or suggests they're not properly attending to their senior loved ones. These psychological concerns are understandable but not medically justified according to current research. The study data shows that seniors who shower 2 to 3 times per week maintain excellent hygiene standards while achieving better health outcomes than those who bathe daily. Social perceptions about cleanliness haven't kept pace with medical understanding about what actually promotes health in aging populations. Overcoming these mental barriers requires education about the difference between social conditioning and medical necessity. Individual factors can modify this baseline recommendation in either direction depending on specific circumstances. Seniors who maintain high activity levels through regular exercise, gardening, or physical work may need to shower more frequently, particularly during warmer months when perspiration increases. Those living in hot, humid climates where bacterial growth accelerates may require additional washing sessions to prevent skin problems related to moisture accumulation and bacterial overgrowth. Conversely, seniors with naturally dry skin, those taking medications that affect skin moisture, or individuals living in dry climates often benefit from showering less than 3 times per week. Some seniors with severe skin conditions achieve optimal results with just once weekly full body washing combined with daily targeted cleaning of essential areas. The key lies in assessing individual needs rather than following universal protocols that may not serve specific health interests. Health conditions significantly influence optimal showering frequency in ways that require careful consideration. Seniors with diabetes need to maintain excellent foot hygiene to prevent infections that can lead to serious complications. But this doesn't necessarily require full-body daily washing. Those with heart conditions may need to avoid the cardiovascular stress of hot showers, leading to recommendations for cooler, shorter bathing sessions rather than frequent exposure. Seniors with mobility limitations may find that reducing shower frequency decreases fall risk while targeted cleaning methods maintain necessary hygiene standards. The success stories from seniors who adopted this frequency reveal improvements that extend far beyond skin health. Many report that switching to twice-weekly showers eliminated chronic itching that had bothered them for years. Energy levels improved noticeably because they no longer felt exhausted after daily shower routines that required significant physical effort. They found that they actually felt cleaner and more comfortable following the reduced schedule than they had with daily bathing. Seniors who experienced skin infections found that these cleared up completely within 6 weeks of making the change. Chronic dryness and cracking on arms and legs disappeared, and many stopped needing prescription moisturizers that had been part of their daily routine for years. Families initially worried about the change but became convinced when they saw dramatic improvements in skin condition and overall comfort. Activity level considerations help determine where individual seniors should fall within the 2 to 3 times per week range. Sedentary seniors who spend most of their time indoors in climate-controlled environments typically do well with twice-weekly bathing. Their bodies don't produce significant amounts of sweat or accumulate substantial dirt that would require more frequent washing. These seniors often report that showering twice per week leaves them feeling perfectly clean and comfortable. More active seniors who engage in regular physical activities, spend time outdoors, or live in warmer climates may need to shower 3 times per week or occasionally more during particularly active periods. The goal is matching washing frequency to actual hygiene needs rather than following arbitrary schedules. Even active seniors rarely need daily full body washing if they focus on cleaning the areas that actually require attention between showers. Living environment factors also influence optimal frequency recommendations. Seniors living in dusty areas, those with pets that shed, or individuals whose homes have higher humidity levels may need slightly more frequent washing than the baseline recommendation. However, even these environmental factors rarely justify daily showering when proper targeted cleaning methods are used between full-body bathing sessions. Alternatives include targeted cleaning of face, hands, feet, and genitals, and using no-rinse cleansing products for aging skin. Use gentle moisturizing wipes and pH-balanced cleansers approved for senior skin. These methods allow effective cleaning without water exposure that damages skin barriers. Targeted washing of essential areas can be performed daily using gentle products while limiting full-body soap and water exposure to the recommended 2 to 3 times per week. This frequency represents the sweet spot between health and hygiene based on current scientific evidence. The research demonstrates that 2 to 3 times per week provides adequate cleanliness for most seniors while allowing skin barrier repair, maintaining beneficial bacteria populations, and reducing fall risks associated with frequent bathroom exposure. This schedule optimizes health outcomes while meeting reasonable hygiene standards. The evidence supporting this frequency comes from multiple research disciplines including dermatology, geriatric medicine, infectious disease studies, and safety research. The convergence of findings across these different areas of study provides strong confidence that this recommendation reflects optimal practice rather than arbitrary preference. But knowing the right frequency is only part of the solution. The real challenge lies in finding practical methods that maintain cleanliness and comfort
hygiene
between those
alternatives
scheduled
that
shower
work.
days. There are scientifically backed alternatives to daily showering that prove more effective for senior health than traditional bathing routines. These methods challenge the assumption that frequent water exposure represents the only path to cleanliness. The 2025 research demonstrates that strategic cleaning approaches can maintain hygiene standards while protecting the skin barrier systems that daily showering compromises. These alternatives work by targeting the areas that actually need attention while preserving the protective elements that keep seniors healthy and comfortable. Simple techniques can keep seniors clean and comfortable without exposing them to the health risks associated with frequent showering. These methods focus on efficiency and effectiveness rather than following arbitrary daily schedules that may cause more harm than good. The key lies in understanding which body areas require daily attention and which areas can be cleaned less frequently without compromising health or comfort. This approach allows seniors to maintain excellent hygiene while protecting their skin's natural defensive mechanisms. The 2025 research on targeted cleansing methods reveals that focusing on high-priority body areas provides superior hygiene outcomes compared to daily full-body washing. High-priority areas include the face, hands, feet, underarms, and genital regions where bacteria accumulate more rapidly and where cleanliness has the greatest impact on health and comfort. These areas produce more oils, accumulate more sweat, and harbor bacteria that can cause odors or infections if not cleaned regularly. Daily cleaning of these specific zones addresses actual hygiene needs without subjecting the entire body to unnecessary soap and water exposure. The targeted approach works because different body areas have different cleansing requirements based on their function and bacterial load. Arms and legs typically don't require daily washing unless they become visibly soiled or develop odors. The torso produces fewer oils and harbors fewer bacteria than high-priority areas, making daily cleaning unnecessary for most seniors. By concentrating cleaning efforts on areas that actually need attention, seniors can maintain cleanliness while giving other skin areas time to recover and strengthen their protective barriers. No-rinse cleansing products underwent significant reformulation in 2025 to become more effective and skin-friendly than previous versions. These products now contain advanced cleansing agents that remove dirt, bacteria, and odors without requiring water for rinsing. The new formulations include moisturizing ingredients that prevent the drying effects often associated with traditional cleansing products. Many contain ingredients that support beneficial skin bacteria while eliminating harmful microorganisms, creating a more balanced approach to skin cleansing. The reformulated products address the specific needs of aging skin by including ceramides, natural oils, and other compounds that strengthen skin barrier function while providing cleaning action. Unlike traditional soaps that strip away protective elements, these products clean while actually improving skin health. They work particularly well for seniors with mobility limitations who find traditional showering challenging or dangerous. The products can be applied with soft cloths or disposable wipes, making them accessible for seniors with arthritis or other conditions that limit hand and arm mobility. Strategic hygiene represents a concept that maximizes cleanliness while minimizing skin damage through careful planning and targeted application of cleaning methods. This approach involves assessing individual needs, prioritizing high-impact cleaning activities, and using appropriate products for specific situations. Strategic hygiene considers factors like activity level, health conditions, skin sensitivity, and environmental exposure when developing personalized cleaning routines that serve individual health interests rather than following universal protocols. The strategic approach involves timing cleaning activities to coincide with actual need rather than arbitrary schedules. Seniors who engage in physical activities may need targeted cleaning immediately afterward, while sedentary seniors may go longer periods without requiring intervention. The strategy also involves using different cleaning methods for different body areas based on their specific requirements. Face cleaning may require gentle, pH-balanced products, while foot cleaning may need antifungal ingredients to prevent infections. Specific product recommendations endorsed by geriatricians and dermatologists include pH-balanced cleansing foams that don't require rinsing, moisturizing body wipes designed for sensitive skin, and gentle cleansing lotions that can be applied and removed with soft cloths. These products undergo testing specifically for senior skin to ensure they don't cause irritation or barrier damage. Many contain ingredients like aloe vera, chamomile, and natural oils that soothe aging skin while providing effective cleaning action. Healthcare professionals also recommend soft microfiber cloths for gentle cleaning between showers, antimicrobial towels that reduce bacterial growth, and moisturizing products that can be applied immediately after cleaning to seal in hydration and strengthen skin barriers. The recommended products avoid harsh chemicals, artificial fragrances, and other ingredients that commonly cause sensitivities in aging skin. Many are available in travel sizes that make them convenient for seniors who want to maintain hygiene routines while away from home. Proper clothing choices significantly impact hygiene maintenance between showers by managing moisture and bacterial growth. Natural fiber clothing like cotton and linen allows air circulation that keeps skin drier and less hospitable to bacterial overgrowth. Moisture-wicking fabrics designed for active wear can help seniors who continue exercising or engaging in physical activities. Daily changes of undergarments remove accumulated bacteria and moisture from high-priority body areas, even when full showers aren't performed. Bedding hygiene extends the time between showers by maintaining a clean sleeping environment that doesn't contribute to bacterial accumulation on the body. Fresh sheets and pillowcases reduce the transfer of bacteria, oils, and dead skin cells that can accumulate during sleep. Using mattress protectors and changing bedding twice weekly creates a cleaner sleeping environment that supports overall hygiene goals. The long-term health benefits of adopting these alternative hygiene methods include improved skin integrity, reduced infection rates, better moisture retention, and enhanced overall comfort. Seniors who implement these approaches often report less itching, reduced skin sensitivity, and improved sleep quality due to increased comfort. Energy conservation from less frequent showering allows seniors to engage in other activities that support their health and well-being. These methods can actually leave seniors feeling cleaner and more comfortable than daily showering routines that strip away protective skin elements. The targeted approach addresses areas that actually need cleaning while preserving the natural protective mechanisms that keep skin healthy and comfortable. Seniors often report that they feel fresher throughout the day when following strategic hygiene approaches compared to the dry, tight feeling that often follows daily showering with traditional soaps and hot water. The effectiveness of these alternative methods depends on proper implementation and consistency rather than frequency. Seniors who learn to assess their individual needs and apply appropriate cleaning methods achieve better hygiene outcomes than those who follow arbitrary daily routines. Watch for persistent infections or skin irritation as signs to seek professional advice. Some health conditions, like incontinence or diabetes, require tailored hygiene routines. Discuss with your healthcare provider if you have specific medical needs affecting hygiene. While these practical alternatives work well for most seniors, it's important to recognize that individual circumstances can significantly influence what approach works best for each person. When seniors need different approaches, medical conditions create specific circumstances that override standard hygiene recommendations and require specialized approaches. Seniors managing diabetes, incontinence, immune system disorders, or chronic skin conditions cannot simply follow general guidelines without considering their unique health needs. These conditions don't just modify frequency recommendations slightly, they fundamentally change what constitutes appropriate and safe hygiene care. Incontinence represents one of the most common situations requiring modified hygiene approaches for seniors. Bladder and bowel control issues create immediate cleaning needs that cannot be delayed without risking serious skin breakdown and infections. Urine and fecal matter contain bacteria that cause painful rashes and tissue damage if not addressed promptly. However, incontinence doesn't automatically mean seniors need daily full-body showers. Targeted cleaning of affected areas using gentle pH-balanced products addresses urgent hygiene needs while protecting unaffected skin from unnecessary soap and water exposure. Effective incontinence care involves using no-rinse cleansing products specifically formulated for sensitive skin that has been exposed to bodily waste. These products remove harmful bacteria without causing additional irritation to already compromised tissue. Barrier creams applied after cleaning create protective layers that prevent future damage from moisture and bacterial exposure. Regular changes of protective undergarments combined with targeted cleaning maintains necessary hygiene while avoiding the skin damage that comes from frequent full-body washing. Diabetes creates another category of seniors requiring specialized hygiene approaches due to compromised circulation and delayed healing. High blood sugar levels reduce immune function, making diabetic seniors more vulnerable to skin infections that can quickly escalate into serious medical emergencies. Poor circulation means that minor skin damage takes much longer to heal and can develop into chronic wounds or ulcers. These factors require careful balance between maintaining adequate cleanliness to prevent infections while avoiding skin damage from excessive washing. Diabetic foot care often requires daily attention despite general recommendations for reduced bathing frequency. Feet need daily inspection and gentle cleaning to prevent infections that could lead to ulcers or amputation in diabetic patients. This critical care can be accomplished through targeted washing that doesn't involve full-body shower exposure. Using lukewarm water, mild soap, and thorough drying addresses infection prevention while protecting skin barriers from damage caused by hot water and harsh cleansing products. Immune system compromise from medications, cancer treatment, or autoimmune conditions creates additional complexity in hygiene planning. These seniors have reduced ability to fight off infections that healthy individuals could easily overcome, potentially requiring more frequent cleaning of hands and high-touch areas. However, immunocompromised seniors also face increased vulnerability to skin damage from over-cleansing, making the balance between protection and cleanliness even more delicate. Their hygiene routines must prevent infection exposure while preserving the skin's natural defensive mechanisms. Chronic skin conditions like eczema, psoriasis, or dermatitis often require approaches that involve less frequent bathing combined with specific skin care protocols. These conditions create compromised skin barriers that become more vulnerable to irritation from soap, hot water, and frequent washing. Dermatologists typically recommend lukewarm water, gentle cleansers, and immediate moisturizing after bathing to prevent symptom flare-ups. Seniors with severe skin conditions may need to limit full-body bathing to once weekly while using alternative cleaning methods for daily hygiene maintenance. Caregivers and family members play essential roles in assessing whether seniors need modified hygiene approaches beyond standard recommendations. This assessment involves observing for specific indicators that signal when additional cleaning becomes medically necessary rather than socially preferred. Visible soil on skin or clothing, noticeable body odors, and complaints of discomfort from sweat or moisture accumulation represent clear signals for immediate hygiene intervention. However, caregivers must distinguish between social expectations for frequent bathing and actual medical requirements for additional cleaning. Ongoing monitoring includes watching for skin changes that indicate whether current hygiene practices are appropriate or problematic. Red, irritated skin may signal over-cleansing, while recurring infections might suggest inadequate cleaning of specific areas. Caregivers should document skin condition changes and hygiene challenges to discuss with healthcare providers during medical appointments. This documentation helps medical professionals understand real-world impacts of current practices and make appropriate adjustments to care plans. Personalized hygiene care plans address individual health needs while incorporating evidence-based practices for senior skin health. These plans consider medical conditions, mobility limitations, cognitive function, and environmental factors when determining optimal hygiene schedules and methods. Effective plans specify which body areas need daily attention, which areas can be cleaned less frequently, and what products work best for individual skin types and health conditions. Care plans also include protocols for managing hygiene during illness, medication changes, or other circumstances that might temporarily alter hygiene needs. The plans identify specific warning signs indicating when medical consultation becomes necessary and provide family members and caregivers with training on consistent implementation while monitoring for changes requiring plan modifications. Warning signs requiring professional medical evaluation include persistent skin infections despite adequate cleaning, worsening of existing skin conditions, or development of new skin problems. Frequent urinary tract infections, recurring fungal infections, or slow-healing skin injuries may indicate that current hygiene practices are inadequate for individual health needs. Conversely, increasing skin sensitivity, chronic dryness, or new allergic reactions might suggest over-cleansing requiring professional intervention. Cognitive changes affecting a senior's ability to maintain personal hygiene also warrant medical evaluation. Seniors who forget cleaning routines, become confused about hygiene practices, or resist necessary cleaning may need modified approaches accounting for cognitive limitations. Healthcare providers can assess cognitive function and recommend appropriate support strategies that maintain hygiene while respecting dignity and autonomy. Consulting healthcare providers about hygiene concerns ensures seniors receive appropriate guidance based on their complete medical picture. Primary care physicians, dermatologists, and geriatric specialists provide recommendations accounting for multiple health conditions and their interactions. These consultations help families avoid confusion and potential harm from applying general recommendations to complex medical situations. The evidence supporting individualized approaches continues to grow as researchers track health outcomes across different senior populations with varying medical needs. The long-term health benefits. When seniors implement these evidence-based hygiene changes, the health improvements extend far beyond what most people expect. A 2025 longitudinal study that followed over 1,000 seniors for 5 years documented remarkable transformations in overall health outcomes. Seniors who adopted the 2 to 3 times per week showering schedule experienced significant improvements across multiple health categories that compound over time to create lasting benefits for aging bodies. Reduced shower frequency has been linked to improved skin comfort and fewer infections in seniors, creating a foundation for better overall health. The skin barrier integrity improvements happen quickly once seniors stop daily stripping of protective oils. Within the first 3 months of reducing shower frequency, seniors show measurable improvements in skin thickness, moisture retention, and barrier function. Advanced skin imaging technology reveals that seniors following reduced shower schedules develop skin barriers that become significantly more effective at preventing moisture loss and blocking irritant penetration. The skin's natural oil production begins recovering as sebaceous glands repair themselves from daily damage caused by hot water and soap exposure. Beneficial bacteria populations rebound as the skin microbiome stabilizes and protective species re-establish their defensive communities. These improvements in skin health translate directly into better overall health outcomes because the skin serves as the body's primary immune barrier against infection and disease. When this barrier functions properly, seniors experience fewer health complications across multiple body systems. Infection rates drop substantially among seniors who modify their bathing routines according to evidence-based recommendations. Urinary tract infections decrease as compromised skin barriers recover their ability to prevent bacterial migration. Skin infections requiring antibiotic treatment decline significantly over time as protective barriers strengthen and beneficial bacteria populations recover. Respiratory infections show notable reductions, likely due to improved overall immune function as the skin barrier regains its protective capabilities. These infection reductions translate into better quality of life through fewer hospital visits and reduced need for medications that can cause side effects in seniors. Pain scores related to skin conditions decrease substantially within months of changing bathing frequency. Sleep quality ratings improve as skin irritation and itching problems resolve. Social interaction increases as seniors feel more comfortable and confident about their appearance and hygiene practices when they understand they're following medically appropriate routines. Energy conservation from less frequent showering allows seniors to redirect their physical resources toward activities that directly impact their health and well-being. Seniors save considerable time and energy by reducing shower frequency, resources they can redirect toward physical activity, social interaction, and other health-promoting behaviors. Physical activity levels often increase as seniors use their conserved energy for walking, gardening, and other exercises that improve cardiovascular function, balance, and muscle strength. The connection between skin health and mental well-being becomes apparent as seniors experience improved sleep quality and reduced anxiety following new hygiene guidelines. Sleep duration increases as skin irritation and discomfort decrease throughout the night. Sleep quality improves substantially as seniors experience less nighttime itching and restlessness that previously disrupted their rest cycles. Anxiety levels related to hygiene concerns drop as seniors gain confidence that their modified routines are medically appropriate and effective for maintaining health. These mental health improvements create positive cycles where better sleep leads to improved cognitive function and mood stability throughout the day. Seniors report feeling more alert, engaged, and emotionally balanced when they're getting adequate rest without skin-related sleep disruptions. The psychological benefits extend beyond just comfort to include increased confidence in their ability to make health decisions that serve their individual needs rather than following arbitrary social expectations. Healthcare costs decrease substantially among seniors who adopt evidence-based hygiene practices, demonstrating the economic benefits of these approaches. A 2025 study showed that seniors who changed their showering routines experienced reduced healthcare costs and fewer dermatology visits. Healthcare spending for skin-related conditions decreases as chronic skin problems improve and infection rates decline. Dermatology visits drop significantly as skin barriers strengthen and protective mechanisms recover their function. Prescription medication costs for skin treatments decrease as seniors require fewer topical medications, antibiotics, and other interventions for hygiene-related health problems. Emergency room visits for severe skin infections decline among seniors following modified hygiene guidelines. These cost savings benefit both individual seniors and their families while reducing strain on healthcare systems that serve aging populations. The benefits compound over time in ways that create increasingly positive health outcomes as seniors continue following evidence-based hygiene practices. First-year improvements in skin health lead to second-year improvements in infection resistance and overall immune function. Energy conservation enables increased physical activity that strengthens seniors and reduces their fall risk over extended periods. Better sleep quality leads to improved cognitive function and mood stability that enhances quality of life throughout the aging process. Long-term aging outcomes show that seniors who adopt modified hygiene practices maintain independence longer and experience better health trajectories throughout their senior years. Functional independence scores remain stable or improve in seniors following evidence-based hygiene guidelines compared to those maintaining daily showering routines. Cognitive function measurements show less decline over time in the reduced shower frequency groups. Hospital admission rates decrease among seniors following the new recommendations. These outcomes suggest that simple changes in hygiene practices can significantly impact the aging process and help seniors maintain their health and independence for extended periods. The practices become increasingly important as skin continues aging and becomes more vulnerable to damage from excessive cleansing. Seniors who make these changes early in their retirement years experience better health outcomes throughout their 70s, 80s, and beyond. The evidence reveals that traditional approaches developed for younger adults may not serve the health interests of aging populations, requiring a fundamental reconsideration of how we approach senior care and hygiene recommendations. Making these changes today could transform your health outcomes for years to come. The 2025 evidence suggests seniors benefit from showering 2 to 3 times per week rather than daily, supporting better skin barrier function and reducing infection risks. This represents a significant departure from traditional hygiene advice, but the medical evidence clearly supports this approach for healthier aging. Talk with your doctor about personalized skin care routines that account for your individual health conditions and circumstances. Every senior's needs are different, and what works for one person may not be appropriate for another. If you're over 65, consider discussing these new findings with your dermatologist or geriatrician at your next appointment. The research shows that simple changes in hygiene frequency can create lasting improvements in skin health, infection prevention, and overall well-being throughout the aging process.